We are delighted to welcome Josh Mailman today at the ICPO Foundation in Wiesbaden. He's an internationally recognized patient advocate. In this interview, Josh and his family will give us insights into his cancer diagnosis, his treatment with radiotheranostics, and his new life as a patient advocate. What symptoms or signs prompted you to see a doctor?
Most neuroendocrine tumor patients have symptoms or have rashes or have diarrhea. I had none of those. I was a 46-year-old male in 2007, riding 100 kilometers a week to and from my work on a bike, and really had no medical issues. And I went in for my 46-year-old checkup, and my doctor felt under my rib cage and said, feels like your liver's sticking a little outside of your rib cage. I don't think it's anything serious. Come back in when you have time and we'll do an ultrasound. Unfortunately, that ultrasound showed a very large pancreatic neuroendocrine tumor, though we didn't know at the time that it was a pancreatic neuroendocrine tumor, just a large mass in my pancreas. And then follow-up scans showed a lot of involvement of my liver as well. This really emphasizes the importance of having your annual checkups and doing preventative maintenance or preventative care for yourself, health care, as without this, I would not have had the time to learn about my disease, to learn about the treatment options that were available, and go exploring new options.
What was the first treatment your doctor suggested to you?
There weren't really a lot of treatments for neuroendocrine tumors. There were surgical removing, if you could have it surgically removed. Unfortunately, my tumor was in a place where it was wrapped around vessels and arteries in my pancreas, and actually having surgery was going to be life-threatening. And there were too many, or something called innumerous tumors in my liver, which made any type of liver-directed surgery at that time not advisable. So my oncologist, since I had no symptoms, seemed stable, seemed in great health, decided to do a watch and wait, which I renamed Watch and Learn so that I could learn more about my disease and not feel passive about what I was doing, but active in my treatment care. So in fact, I really didn't have any treatment suggestions other than we're going to watch, see what this does, learn about this disease, and when the time comes, we'll make the right decisions. Now, this is back in 2007 when there weren't a lot of treatments. We didn't have any radiotherapy available in the United States at that time. It was very limited elsewhere in the world. And there were just very few clinical trials for someone like me who had a large pancreatic tumor and innumerable liver tumors. So we waited, and we waited until I finally had disease progression, finally had symptoms, and at that time I was put on large doses of sandostatin analogs while we tried to figure out what was my next best move.
Where did you find out about radiotheranostics, and where have you been treated?
So as I said, in 2007 and 2008, there weren't any specific treatments for the type of disease I had. Or how I presented with my disease. I didn't have symptoms, I didn't have other things going on that would, rapid growth that would require immediate action. So we used that time to watch and learn. And one of the things we learned, or one of the things I learned, is I went to patient-generated conferences, and one of them was in Toronto in 2008 in the fall. And I was looking and hoping for new information that would help me in my decision-making process when and if I needed treatment. And I was a little disappointed. Day one was all about somatostatin analogs, which at that time wasn't something that I was eligible to take because I had no symptoms and no growth. And then the second half of the day was all on surgery, which is something I couldn't have without the possibility of bleeding out on a table, so not really interested in either of those two options. The second day of the conference, there were some Europeans in the audience, or European medical professionals who gave talk, One of them was Dr. Richard Baum, and his presentation was on this new type of imaging called gallium-68 DOTA something. And I remember looking at, now I was in the tech business, and so I like data. Data is good. And he was giving a talk about how much more data there was in a gallium-68 DOTA scan, and how much more sensitive it was, how much more specific it was. And with that talk, I went up to him at the end of the talk and said, introduced myself and said, I think I need one of these scans because what we have was unclear medicine. We had the scan that was approved 20 years ago for neuroendocrine tumors that gave you kind of a cloud look of what the disease looked like, where the gallium-68 gave you a pinpoint look over your whole body and could see things that we weren't able to see with the other full body technology. And Dr. Baum looked at me and actually said, we have an appointment for you 6 weeks from now. And so I flew over right during Christmas markets in Berlin and in Bad Berka, where he was at the time, and had my first gallium-68 DOTA something. I cannot remember whether it was DOTA talk or DOTA Tate. And what I found was that in my particular case, the DOTA scan showed the exact same information that my Octria scan plus a CT showed. However, it showed that I had very high uptake. Dr. Baum looked at me and said, I don't treat people who are stable and who have a great quality of life, and you have both of them. But should you ever need treatment, now this was in December of 2008, looks like we have this thing called PRRT, and it will be a really good treatment for you to try. You are highly receptive, and if the time comes, please contact me, as I would be more than happy to treat you. The time came in March of 2009 when my before non-functioning, non-symptomatic tumors turned into fully functioning lymphoma. And I needed treatment, and there wasn't much treatment in the United States. And I called Dr. Baum and left him messages, and after a few, you're doing great, why do you think you need treatment? I got to him and let him know how much I had progressed in the 4 months since or 3 months since I saw him. And he immediately gave me an appointment for my birthday in 2009, where I had my first PRRT treatment. And subsequently, he gave me another appointment at my anniversary for my second PRRT later on in that summer. And lastly, in 2010, I had another round of PRRT, or another treatment of PRRT, on my father's birthday as well. So somehow it just all worked out. And those 3 treatments stopped all the symptoms I was having and reduced my disease by over 50%.
Were there any side effects of the treatment you particularly struggled with?
So about side effects of PRRT, we're all different. All of us who have radionuclide therapy will experience different types of side effects. And even the same person, myself, have experienced different side effects depending on what cycle it was and whether I was symptomatic going into that treatment. My first treatment, again in 2009, was pretty early in the development of PRRT. Now, first in human was obviously in 1999 or 2000, and we're talking 2009, so there'd been a fair amount of development, but yet I came in what's known as somatostatin analog naive, never having taken long-term somatostatin analogs. And when I had my first treatment, besides what we normally expect, which is fatigue, we call it chemo brain, or a little bit of brain fog, some nausea, which these things are all easily handled with, nausea drugs or other things, rest. Fatigue, really good to have a lot of rest. But I also had what we call a hormonal bloom, or I kind of described it like Star Wars being an attack of the Death Star. I was, or The Empire Strikes Back, much like the movie, I was red from the top of my waist all the way through my head. And what was happening is, since I was hormonally secreting VIP, which is what I had, the treatment actually made me over-secrete VIP in such a way that I was bright red. And this was early on. Now we give somatostatin analog long-term shortly after the treatment, and at the time in 2009, I wasn't even given short-acting sub-Q. By the time I came back for my second treatment, the staff had already decided that if I went through another hormonal bloom, which I did on my second treatment, as I said, even each of us on each treatment may react differently. The second treatment, I had none of this hormonal bloom. But my fourth treatment I did, that they immediately gave me sub-Q or short-acting octreotide, and it immediately took care of that hormonal bloom. Those were my side effects. You would have to look at the label and the study of NETTER-1 or NETTER-2 to see what the totality of side effects are. And just a reminder, we're all different, we all don't get them, and we all don't get them every time.
Has the treatment been successful?
How we define success. When I was diagnosed in 2007 with a really large pancreatic tumor, neuroendocrine tumor, and a lot of liver mets, 70% of my liver taken over by tumors, was unclear how long I would live and whether I would see my newly born son, who was only 10 months old at the time of diagnosis, through to his first or second year birthday, let alone see him graduate high school. I'm proud to report that there's only 1 year left till he graduates high school, and I think I will hit that milestone as well.
You nearly missed your second treatment. What had happened?
So I think one of the things that patients need to understand is radioisotope treatment is not exactly the same as getting a pill from the dispensary from the chemist. These are treatments that are really made to order and very much like just-in-time inventory. They have a very short half-life, sometimes days, sometimes less than a week, sometimes hours. And they're made at the time that they're needed. So they're not stored like we think of with our regular chemotherapies or other types of drugs that we take, which means there can be slip-ups, there can be challenges. I'm fortunate that for all of my 5 PRR treatments and most of my imaging treatments, these radiopharmaceuticals were available at the time that I needed to be treated or have diagnostic scans. I did have one challenge when I was, for my second treatment, where it was freezing cold in Bad Berka and the surrounding areas around Bad Berka, and the drug was being radio labeled somewhere in the mountains by the company ITM. And they had not parked their radio protected car in a place that would keep it warm. It was a diesel. And the actual car froze, the diesel block froze. And a treatment that I was supposed to have at 11 o'clock in the morning could not be transported because the actual car could not run. They worked feverishly to get the car block unfrozen, so in fact they could deliver the treatment to me before the time that decay would happen, where the treatment would no longer be effective, or less effective, and I was able to get that treatment later on that day before that time ran out. So I've been really fortunate in all the treatments that I have never to have missed a treatment because of this complicated dance of getting this radiopharmaceutical to your arm. I have missed one imaging in the 14 years because the radio isotope did not label well with the peptide, and I needed to come back for another time for imaging. But this happens because there is a delicate dance. So you need to understand as a patient that you may not always get things at the right time or when you expect them because of the challenge of delivering these on time and making them literally hours before they're going into your body. But for the most part, they are available when you need them.
How do you manage to stay mentally strong during your treatment phase?
So the interesting thing for neuroendocrine tumor patients and many patients undergoing cancer treatments, mentally strong during your treatment phase, many of us are not cured, or we like to call it NED, which is no evidence of disease. We're always in the treatment phase. We live in the treatment phase. Yes, there are times that people have anxiety when for many years, knowing that I was going to take a scan led to a little anxiety before the scan because that would dictate what would happen in the next 6 months or 2 years. But I've learned to overcome that anxiety because I know there are a lot more options available to me and that we will just figure them out. But part of it is knowing your body and knowing when to take time. I recently had a therapy that wasn't a radiotherapy, and the fatigue, I built in 6 weeks of time to take that time to rest, to take that time to let your body heal. And part of it is preparation. Whether you come into a treatment cycle prepared and with things set in motion so that you have time to recover, have time to rest through the fatigue, have time really just to take time for yourself. Listen to your body and take the time that you need. So virtually, we're always in a treatment phase, and I try to do things with my family, do things with friends, do things with my community that allow me not to focus all the time on the treatment.
Today you are a globally recognized patient advocate. How did you grow into this role and what does it mean to you?
So I never really started out thinking that I would be a patient advocate. As a matter of fact, when I started with this disease and went to my first support group meeting and was asked to give an interview, I refused to use my last name because I wanted to keep my privacy. But what I learned is that part of what's in me is the desire to become an advocate or to advocate for others is the challenge of not wanting others to repeat all the things that I had to learn and understand in my journey. And I wanted to share that. And I wanted to share that so they wouldn't have to experience the same problems, the same issues, and I hope to make it a better place for other patients who are diagnosed with neuroendocrine tumors or with any type of cancer. Now, part of this is, I call it being an accidental tourist, but part of it was, in fact, helped by Dr. Richard Baum, who invited me to the first Theranostics World Congress back in 2011. I didn't know why anyone would invite me to a medical conference in the middle of Bad Berka, in the middle of Germany, where I was one of only 2 patients and only one of 6 Americans at this conference. But it would be a pivotal turning point in my advocacy journey, one of many that have led me to be a global advocate at this point. So at that fateful conference, during the gala dinner, I was walking downstairs to go where all the general attendees were going for their dinner, and Dr. Baum pulled me aside and said, "No, you need to go upstairs where the VIPs and the speakers are actually having dinner because you're, as a patient, one of the most important people here." And so I went upstairs not knowing anyone, and my German is not very good, so very worried that I'd have no one to speak to. And by happenstance, I sat next to a man who lives 6 miles away from where I live and is the radiochemist at UCSF. And as we talked to each other, he said, do we really treat neuroendocrine tumor patients in the United States at UCSF, where I've been ordering this thing called Bacterioscan? And I said, yeah, I was wondering why you were here with gallium-68, because there's none of it in the US. And he said, well, we use it for animal models, for taking images of animals. And we talked throughout the night. And by the next morning, he said, we're starting a patient advocacy advisory board with the SNMMI. Would you like to join? I'd like you to be a member. And I looked at him, probably like most patients back then would. So what is the SNMMI? I have no idea what those letters mean. Actually, back then it was the SNM. And he explained it was a medical society for nuclear medicine physicians and technologists. And I joined, and one thing led to another. My oncologist invited me to apply for being an advocate for the National Cancer Institute's neuroendocrine task force, which looks at all the trials that will happen in the neuroendocrine tumor space that are provided by the cooperative groups. And I said yes and was elected to that, where I served for 6 years. I then was actually nominated and selected for the National Cancer Institute's GI Steering Committee, where I served 7 years and became the co-chair for the Patient Advocate Steering Committee, where we teach 70 patients how to evaluate concepts for clinical trials. And one thing led to another, and this global enterprise started of being invited to different conferences to give talks, to work with policymakers. I'm now have been hired as a special government employee for the Nuclear Regulatory Commission, where I serve on the advisory committee on the medical use of isotopes. I also teach clinical trial design for the American Society of Clinical Oncology and the AACR, and something we call the VAIL workshop, or the methods of clinical workshop design, where we teach young investigators how to perform a phase 1, phase 2 trial, where I work on both medical ethics and informed consents, where I read all their trial protocols and help them deliver better and more patient-meaningful clinical trials. I sit on boards of many different nonprofits, including the Neuroendocrine Tumor Research Foundation, where I've helped raise over $25 million for the research of neuroendocrine tumors. And most recently in 2020 or 2021, I'm a co-PI with the University of Iowa on a comparative effectiveness research grant from an organization called PCORI, where we received $5.1 million to understand how different treatments affect neuroendocrine tumor patients. So from a humble beginning in being redirected for dinner in Bad Berka, I now work with many agencies and foundations in the United States and across the world.
Looking back, what was the hardest time for your family?
So I think for patients undergoing or getting that cancer diagnosis, the initial cancer diagnosis is always the toughest. Largely because there's a lot of uncertainty involved, and largely because of what we're pre-programmed in the press and the media to understand about cancer. So I would say by far the toughest time was post-discovery. I won't say post-diagnosis, because discovery is when you actually find a scan that shows you have something, but you may not have a diagnosis. In my case, having that ultrasound and CT didn't actually give me a diagnosis. It gave me discovery. And I wouldn't be able to find a diagnosis until several weeks after, or 2 weeks after, when we could find time to get an actual biopsy, there was things that are out of your control. There was a biopsy table shortage. I didn't even know there could be a biopsy table shortage, but there was a biopsy table shortage in the San Francisco Bay Area at the time. My initial diagnosis came, on a Thursday, Friday. We had some initial other scanning the following week, but a diagnosis could not be made via biopsy until the next Monday or the next Tuesday after the Labor Day holiday. So uncertainty for cancer patients is probably the most challenging. It's probably that moment in time where you don't know exactly what it is that you're up against, exactly what type of treatment path you might take, and exactly what the arc of your disease might take. And for us, that was exacerbated by the fact that we had times to schedule these extra imaging diagnostic tests, and even that was inconclusive for my disease, and had to wait till a biopsy and the biopsy report came back. So these were the hardest times, the times of not knowing exactly what you have. We had a family event to go to in between. We canceled that event originally because we just didn't want to fly back not knowing. But then when we couldn't get a biopsy until after this Labor Day holiday, we decided to put that on. And in the middle of all this uncertainty and potential sorrow, we had joy of being with our family. And I think that's one of the dichotomies of being diagnosed with cancer, is that you need to have joy. You need to have reasons to live. You need to have reasons that you want to continue. Because if all you are doing is worrying and being in stress, then what's the point of living this life anyway? But there is a lot of stress that can happen during this time. And for us, this time until we got a definitive diagnosis, and then maybe the first month after, when we were trying to figure out what you do with that definitive diagnosis, was by far the most stressful time for both myself and my family.
When did you realize that your father has cancer?
I would have to be about 4 years old. So the topic of cancer is never really like a far away thing in our family circles. We always used to talk about, going to the doctor, the dentist, all these type of medical things. So I had a background to really understand what was going on. But around the age of 4 was when my family really started to introduce me to the idea of my dad having cancer. And it was definitely hard to understand at first. You're 4, you don't have the understanding that I do now. But it was mainly to just grasp my head around the idea that something was different. My dad was leaving a lot, going lots of different places to have treatment, and that was different from the other kids that I was around. So it was mainly to help me understand how I could help, and not even how I could help, but how they could help me understand what's going on and truly try to live with it and work with it and have a better understanding of how my dad is doing and what he's doing in life.
Eli, what was the most difficult time for you?
Some of the most difficult times, it's a range for me. It's often times when I don't see my dad and I have a little understanding of what's going on. He goes for treatment and tests in a wide variety of places, whether it's in Germany, DC, or in our backyard in San Francisco. However, I'm never there when he gets them. The only time I'm there is when he's wheeled out in, a bed, strapped to things, and I can ask how he's doing. And those are always the scariest time for me because I don't know. I'm often in school or with my friends while he's getting what he calls pumped full of chemicals. And he'll text me or he'll call me saying that he's escaped or, he's won for now. But those are definitely the scariest times because I can't talk to him. I have no clue if anything's gone wrong, and whatever happens is completely out of my control. The only time that I get a little piece of information is either if my mom's there or when he wakes up. So for those countless hours when he's in procedures or undergoing tests, having needles stuck through him or being pumped full of radioactive material, it's scary. I don't know. Something could easily go wrong and I will never be there to say bye or try to prevent it.
What impact did your father's cancer have on your life?
My life has varied in different points of time due to my dad's cancer. I'm like every other 17-year-old. I have fun, I play with my friends, I play on a soccer team, I like to travel. But these all differ slightly because he has cancer. With my friends, I oftentimes don't have somebody to talk to because they don't understand the situation I'm in. And for those that I do, they're always worried and have more questions than I have answers to. But they're nice and support. And while I'm still 17, I'm still allowed to have fun with them and attempt to be myself in a time where it's hard. With my family, we travel a lot. We go lots of places, often with my dad for reasons that he has cancer. But it's not our entire life. We like to differ having cancer and living life from each other. It's important to see both sides of the world. Opportunities in life, it's hard. I have many more opportunities in many different spaces of the world. I have an internship at the NIH that I would never get to without my dad. But at the same time, there are also things that I can't do because I don't want to be away from him for that long, or I don't want to be in a position where I can't contact him or help him. I was recently playing soccer in Costa Rica. Without my unaware, my dad was in the ER. Almost half the trip. I was unaware of this, and this is why going places and doing things outside are hard to me, because I didn't know. I mean, my dad's in the ER and I was playing and I couldn't tell you what was happening. So for those instances, it's hard, and I need to be closer to home and try to stay in touch.
Have you talked to other kids about cancer?
I try as much as I can to educate those around me about cancer. I started when I was about 9 or 10, presenting to my class about what is cancer and what are neuroendocrine tumors, because people my age don't understand. They don't have somebody like them to talk to, or if a kid is diagnosed, oftentimes he doesn't live long enough to tell. So I try to tell stories and talk to people and make slideshows. When I was 9, I made a slideshow about neuroendocrine tumors that my dad still uses. But it's important that I share the information in a fun way, a way that gets people my age to engage with it. As many doctors or people try to talk to them about it, it's hard. They don't understand it. They use big words and languages that I can't even understand sometimes, and I've spent almost my life trying to understand it. So I dumb it down or simplify it to engage my friends or kids my age, and hopefully have them take an interest and ask questions or really dive deeper into cancer as a whole and neuroendocrine tumors in a specific part of it.
What advice would you give someone whose parents have been diagnosed with cancer?
For those who have been diagnosed with cancer and for their kids, it's important to reach out. Community is the most important step. Doing this alone will never work. It's important to find people who are like you, and for your kids to reach out and talk to them and try to find people who are like them, because as almost everybody can attest to, being alone isn't happy. It doesn't help. You need people who support you, not only who are like you, but who may be going through similar things in your life and in their life. After community, it's important to talk. Having clear ways of communication is essential. Without it, confusion, arguments, and fighting will just take over. Have a set time and place to talk. Me and my family, it's dinner table. Sit down dinner every single night. No phones allowed, and we talk. Without that, we'd go insane. In order to talk about our day, any struggles, and be open and there for each other. It's one of the things that helps me ask questions or understand what's really going on throughout my parents' day and how my dad's doing, because I don't know and I need to ask, and that's when I do it. So after you join a community and talk to your kids, have fun, because it's not great letting something else control your life. Control your own and make sure to enjoy it with those who you're around.
For you as a wife and a mother, what was the most difficult time?
The most difficult time for sure was when Josh was first diagnosed. An ultrasound showed a large pancreatic mass. He came home and told me. I did what anybody would do and quickly did an internet search. I found that for most pancreatic cancers, patients have a poor quality of life and live a few months, maybe a year. That was my only internet search. I turned off the computer. We went to an appointment with his primary care physician the next morning. I was not very hopeful. His doctor walked into the exam room with tears in her eyes, holding a yellow Livestrong binder. And from that moment, she didn't even need to speak. I knew what she was about to say. So she told us he most likely had cancer. We wouldn't know anything more about a specific diagnosis or treatment options until he could have a biopsy. This was around Labor Day weekend. It took us a week to get a biopsy, and then several days, a week or two, until we got the results. The waiting in that time was extremely painful. And in fact, it was so difficult. I remember thinking at the moment that I'm going to look back on this time a year from now and wonder how we ever got through it. The things that were going through my mind: we had a 10-month-old baby. It was our 3rd wedding anniversary. I did not think that our son would have living memories of his dad. I was thinking about how I was going to live life as a widow and a single mother. It was an extremely difficult time. And whoever would have thought a neuroendocrine tumor would be a good thing when you're thinking pancreatic cancer with such a limited lifespan? We found out Josh had a neuroendocrine tumor. We were extremely fortunate at the time that he was quickly diagnosed. He was symptom-free, and at least at that point in time, we could live our lives as we had been as a family with a baby. We spent the next year, a little more than a year, learning. And it was a very important time for us. We took full advantage of the opportunity to learn and be prepared. And it really helped in our journey.
How important was it for you to meet other cancer patients and exchange experiences?
Meeting other cancer patients, and especially for me, meeting their families, has been extremely important. I would say there are 3 major reasons. First, having people on the journey with us. It's extremely helpful to have people who've been through what we are going through We can learn from them. We can hear about experiences patients have with treatments, with quality of life, with making decisions. And for me as a caregiver, it's especially important to be able to connect with other spouses and mothers to understand what it takes to be a caregiver, how I can give the best care, how I can learn to take care of myself so that I can be available as a wife, as a caregiver, as a mother in our family. That has made all the difference. And in the process, we have also made lifelong, extremely close friends who we would not have otherwise met. Second, I would say, as a caregiver, the love and support that I get from others who have gone through this experience is phenomenal. And I would say, take all the support you can get. And as a caregiver, think about what you need. People really do want to help. And I didn't understand that in the beginning. And so for me to be able to let them know how they can best help and support us is so important. And that is something I've learned from talking to others and from lived experience. Third, and probably most important in meeting other cancer patients and their families, was understanding how to talk with children. For those of us who have children, who have a parent with cancer, speaking with them, keeping a semblance of a normal family, having fun, living our lives, and still maintaining the reality of the situation we're in, takes a lot of getting used to. And I read a lot of books, but I talked to a lot of people, and that really helped. And the lessons that I learned from that were always tell the truth, be honest, give age-appropriate information. I found over the years we often had the same discussion, but each year we could give a little more because our son, who was 10 months old when his dad was diagnosed and is now nearing his 18th birthday, lived through every year of his life with this circumstance. And so the advice I got, which was so helpful, was be truthful, tell him as little as you can so that he understands what is going on, but not too much to worry him or scare him. And that type of communication changes as a child gets older. And along with that, most important is to stop and let them ask questions, because we don't know what they're thinking about, what they're afraid of, what they're seeing, what they're hearing. And so giving information, giving age-appropriate information, letting the child ask questions, and bringing the child with you. We have taken Eli to Germany to meet Dr. Baum. We have taken him to UCSF to meet the doctors there. We have brought him to conferences. We have had doctors and other care providers over to our house for dinner. For us, it's part of our family, and we have open dialogue. We have it as much as is needed, which changes over time. So with that, I would say the most important thing is to talk to your children. You know your children best. You know the best way to talk to them, and keeping in mind that being honest, giving age-appropriate information, and letting them ask questions is most important. And letting them know this is something that we are okay talking about. I will say one big challenge is I could not control the reaction of others. And my biggest worry wasn't what I would need to tell my son or talk to him about, but what other kids at school who heard his dad had cancer might say, or what other adults in his presence might say. And I'm not sure there's any way around that, but every year we did have a meeting with Eli's teachers, and we told them exactly what was going on. We asked them to keep open eyes and ears and let us know if any discussion was going on that would be helpful for us to talk with Eli about. And we also let them know that there may be times when our family might need extra support. It didn't happen a lot, and we didn't always know when it would happen, but having community, having families, having school staff and teachers helping out and supporting you is a blessing beyond words. And we were fortunate to always have that.
What advice would you give to someone who has just been diagnosed with cancer?
To persons and families recently diagnosed, I would say, learn as much as you can. Get multiple opinions. Talk to people, and to make it easier, sometimes have another person share the information with friends or family so that you don't have to. Be sure to accept all the love and support you can get, and think about ways people can support you. They really want to. If you have children, be open and honest with your children. Talk to them. Give them age-appropriate information. Let them ask questions. And make sure that your life goes on, you have fun, you have good times as a family, and you also make it clear that it is okay to talk about this whenever needed.